You may believe that dying in your sleep only happens to people who are already very sick. But the truth is that silent killers strike during the night more often than most realize. Chest pain, sudden sweating, breathing pauses, or unexplained confusion can all be warning signs that the heart, the brain, or the lungs are under attack while you rest. As a doctor, I am begging you to never overlook these signs, because they may mean the difference between waking up safely or never waking again. In this video, I will reveal 10 hidden dangers you must watch for and safer habits that could protect your life. Before we dive in, if you have not subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. If you find value in this video, type 1 in the comments. And if not, type 0 so I know how to make better content for you. Part 1. Sudden cardiac arrest and heart rhythm collapse. The first and most dangerous sign you must never ignore is sudden cardiac arrest. The moment when the heart abruptly stops beating, unlike gradual heart failure, which may take years to progress. Sudden cardiac arrest strikes in seconds, often while a person is asleep. Studies show that nearly 1/4 of all cases of cardiac arrest occur during the night, between 10 p.m. and 6 a.m., when families are least prepared to respond. The tragedy is that without immediate intervention, death follows within minutes. What makes this condition so terrifying is how silently it appears. A person may go to bed feeling only mild chest discomfort or none at all, and then never wake again. The underlying causes include blocked arteries, electrical disturbances in the heart's rhythm, or scarring from past heart attacks. Arrhythmias are a key factor. Normally, the heart contracts in a steady rhythm, pushing blood to every organ. But when the electrical signal is disrupted, the beat may become too fast, too slow, or chaotic. In ventricular fibrillation, the lower chambers quiver instead of pumping, and circulation halts instantly. Without blood flow, the brain is starved of oxygen, and unconsciousness occurs in less than 1 minute. Families often describe hearing an unusual gasp or nothing at all before discovering their loved one unresponsive. Some people experience warning signs before sudden cardiac arrest. These include chest pain, palpitations, shortness of breath, unexplained sweating, or dizziness during the day. Others notice skipped beats or fluttering sensations in the chest, but dismiss them as stress or fatigue. For seniors, especially those with high blood pressure, diabetes, or a history of smoking, these red flags should never be ignored. Research published in cardiology journals shows that sudden cardiac death is more likely in individuals with structural heart disease, enlarged hearts, or genetic conditions such as long QT syndrome. In certain populations, especially in Asia, sudden unexplained nocturnal death syndrome has been linked to genetic mutations affecting the heart's electrical pathways, often claiming young men in their sleep. The experience for survivors who are revived is often described as abrupt fainting with no memory of distress. Those who live through it usually owe their survival to immediate cardiopulmonary resuscitation or access to a defibrillator. But during the night, when no one is watching, the chances of rescue are low. That is why prevention is essential. Regular checkups, treatment for arrhythmias, and monitoring of heart health can dramatically reduce risk. Seniors should pay attention to new or unusual chest sensations, unexplained fatigue, or breathing changes, and seek medical advice without delay. If this first danger has surprised you, wait until you learn about the next one, where even a simple heart attack can quietly turn fatal during sleep and rob you of the chance to call for help. Part 2. Heart attack warning signs during sleep. The second sign you must never overlook is the silent heart attack that can occur during sleep. Unlike the dramatic scenes you may see on television, many heart attacks unfold quietly at night, stealing life before anyone realizes what is happening. A heart attack, or myocardial infarction, occurs when a blood vessel supplying the heart muscle becomes blocked by a clot or a buildup of plaque. Without oxygen, the affected tissue begins to die within minutes. During the day, chest pain, jaw discomfort, or shortness of breath may send someone rushing to the hospital, but at night, these same signs may be ignored or missed entirely. The body at rest often masks symptoms. A person may simply feel restless, sweaty, nauseous, or complain of indigestion before drifting back to sleep. In some cases, the only clue is sudden sweating that soaks the sheets, or an unexplained sense of anxiety or doom. Seniors with high blood pressure, diabetes, or a history of smoking are especially at risk. But even those who appear otherwise healthy can be struck without warning. Women and older adults often present with atypical symptoms such as fatigue, lightheadedness, or discomfort in the back or shoulders, rather than the classic crushing chest pain. Families may recall their loved one waking briefly, complaining of mild discomfort, then returning to bed and never waking again. The tragedy is that the signs were there but dismissed as minor. Medical research has shown that nighttime heart attacks can be more deadly than daytime ones because the emergency response is delayed. When the heart muscle dies, electrical activity becomes unstable, and arrhythmias or cardiac arrest may follow quickly. In fact, a massive heart attack can stop breathing by affecting the brainstem, leading to respiratory arrest in the middle of the night. That is why it is so important for seniors to know the subtle signals. If you ever experience chest tightness, unusual pressure that radiates to the jaw, neck, or shoulder, sudden sweating, or unexplained nausea during the night, do not dismiss it as indigestion or a bad dream. Call for help immediately. Doctors emphasize that time is muscle, meaning the sooner treatment begins, the more heart tissue can be saved. The use of aspirin, early access to emergency care, and lifestyle measures to lower cholesterol and blood pressure all reduce risk. Preventive care, including regular checkups and stress tests for those with a family history, is vital. Even something as simple as maintaining a balanced diet, avoiding late-night heavy meals, and limiting alcohol before bed can reduce strain on the heart. Remember, a heart attack does not always shout. Sometimes it whispers, especially at night. If this surprised you, wait until you hear about the next danger, when congestive heart failure silently progresses and may turn fatal in your sleep. Part 3. Congestive heart failure at night. The third sign you must take seriously is congestive heart failure, a condition that can quietly worsen during the night and end life while you sleep. Heart failure does not mean the heart has stopped completely. It means the heart muscle is too weak or too stiff to pump blood effectively. Over time, this leads to a backup of fluid in the lungs, swelling in the legs, and strain on every organ. During the day, you may notice fatigue, difficulty climbing stairs, or swelling around the ankles. But at night, the risks become more severe. When lying flat, fluid shifts more easily into the lungs, leading to sudden shortness of breath, or what doctors call paroxysmal nocturnal dyspnea. Seniors may wake gasping for air, coughing, or needing to sit upright to breathe, sometimes mistaking it for asthma or a bad dream. In severe cases, the buildup of fluid and pressure overwhelms the lungs and heart, triggering respiratory arrest or cardiac arrest. Families sometimes recall hearing their loved one coughing heavily, complaining of chest tightness, then collapsing before help could arrive. Warning signs that congestive heart failure is approaching its end stage include persistent fatigue, swelling in the legs or abdomen, unexplained weight changes, confusion, fainting spells, or loss of appetite. These symptoms are the body's signals that circulation is failing. Medical research shows that hospital admissions for heart failure often spike at night because fluid redistribution stresses the weakened heart more when lying down. High blood pressure, previous heart attacks, diabetes, and kidney disease all increase the risk. Seniors with these conditions must be especially vigilant. The tragedy is that many ignore these nightly episodes, assuming they are minor, but each episode of nighttime breathlessness or swelling is a red alarm that the heart is struggling to keep up. Treatment can extend life and improve quality of sleep. Doctors may prescribe diuretics to reduce fluid, medications to strengthen the heart, or devices to regulate rhythm. Lifestyle adjustments such as reducing salt intake, sleeping with the head elevated, and avoiding heavy meals before bed can make a big difference. Oxygen therapy may also be recommended for severe cases. The key message is that congestive heart failure is not a disease to be endured silently. It is a condition that requires action and medical attention, especially when symptoms worsen at night. If left unchecked, it can result in sudden death during sleep, often mistaken as peaceful, but in reality caused by the final exhaustion of the heart. Awareness and timely intervention can prevent this outcome. If this third danger has opened your eyes, wait until you hear about the next one. When a stroke during sleep can silently damage the brain and end life without a chance to respond. Part 4. Stroke while sleeping. The fourth sign you must recognize is the risk of stroke occurring silently during sleep. A stroke happens when the blood supply to part of the brain is interrupted, either because a clot blocks an artery or because a blood vessel bursts. Unlike a heart attack that damages the heart muscle, a stroke injures the brain, the control center of every movement, thought, and memory. What makes strokes at night so deadly is that there is often no one awake to notice the warning signs or call for help. A person may go to bed speaking normally and moving easily, yet wake, unable to move one side of the body, unable to speak, or, in the most tragic cases, never wake again. Studies show that a significant percentage of strokes occur between midnight and 6 a.m., a time when blood pressure fluctuates, circulation slows, and the body is more vulnerable to clots or vessel rupture. Seniors with high blood pressure, atrial fibrillation, or diabetes are at greatest risk, but anyone can be affected. The signs may be subtle. Sometimes it begins with unusual snoring, restlessness, or sudden confusion if the person briefly wakes. Other times, a severe headache, dizziness, or blurred vision may appear, but be dismissed as fatigue. Families often discover the damage in the morning when a loved one is unable to get out of bed, cannot speak clearly, or has a drooping face. Medical evidence confirms that strokes during sleep often lead to worse outcomes because the golden window for treatment, usually within 3 to 4 hours of symptom onset, is missed. By the time the person is found, it is too late for clot-busting drugs or emergency surgery. This is why prevention is critical. Managing blood pressure, controlling blood sugar, taking prescribed medications for heart rhythm, and not ignoring warning signs like transient episodes of weakness or slurred speech are vital steps. Doctors also emphasize the importance of sleep apnea evaluation, as untreated apnea raises stroke risk significantly. The sensation of waking with sudden weakness, difficulty speaking, or severe headache is not something to brush off. Even if the symptoms fade quickly, this could represent a transient ischemic attack, sometimes called a mini stroke, which is a warning that a major stroke may be imminent. Safer habits, such as regular exercise, limiting salt, and ensuring consistent sleep quality, reduce the risk. It is important to remember that a stroke does not always announce itself with pain. Sometimes the only sign is silence. A quiet night can end with devastating disability or sudden death. Recognizing the risks and taking steps to reduce them can make the difference between independence and tragedy. If this warning shocked you, wait until you hear about the next danger, when respiratory failure can silently take away oxygen and end life before dawn. Part 5. Respiratory failure and lung-related causes. The fifth sign you must take seriously is respiratory failure, a condition in which the lungs can no longer provide enough oxygen or remove enough carbon dioxide to keep the body alive. While heart problems often receive more attention, the truth is that many seniors die in their sleep because their lungs fail silently during the night. When you are awake, your body compensates for breathing difficulties by adjusting posture, coughing, or taking deeper breaths. But during sleep, these protective responses are weaker. If your lungs are already compromised by chronic illness, the danger becomes much greater. Conditions such as chronic obstructive pulmonary disease, pulmonary fibrosis, or neuromuscular disorders gradually reduce the ability of the lungs to function. At night, oxygen levels may fall sharply, while carbon dioxide builds up in the bloodstream, leading to confusion, restlessness, or sudden awakening gasping for air. In severe cases, breathing simply stops, and without immediate intervention, death follows quickly. A classic pattern seen in people approaching respiratory failure is called Cheyne-Stokes respiration, in which periods of rapid deep breathing alternate with pauses or shallow breaths. Family members may notice these unusual patterns in their loved ones at night, sometimes mistaking them for heavy snoring. Another red flag is frequent awakenings with shortness of breath or the need to sit upright to breathe comfortably. These episodes are often brushed aside as normal aging or poor sleep, but they are serious indicators of a body struggling for oxygen. Seniors with advanced heart failure are particularly vulnerable because weak heart function and fluid buildup in the lungs worsen oxygen exchange. This combination can create a deadly spiral during sleep. Even medications, such as sedatives or narcotics, can depress the brain's drive to breathe, pushing someone with fragile lungs into respiratory arrest. Medical studies show that untreated sleep-related breathing disorders significantly increase mortality in older adults. The signs may include morning headaches, dry mouth, fatigue, or unexplained confusion upon waking. Oxygen monitors used during sleep often reveal dangerous drops that the person never notices. Fortunately, there are preventive measures. using prescribed oxygen, following treatment plans for chronic lung conditions, and avoiding sedatives or alcohol before bed all help reduce risk. Devices such as continuous positive airway pressure machines can keep airways open and maintain safe oxygen levels. Doctors also recommend maintaining a healthy weight, avoiding smoking, and keeping vaccinations up to date to prevent infections that strain the lungs. The most important message is to never ignore repeated nighttime breathing problems. If you or someone you love experiences sudden gasping, pauses in breathing, or unusual breathing patterns during sleep, seek medical evaluation immediately. Respiratory failure may appear gradual, but its final strike is often sudden and silent. If this danger concerns you, wait until you hear about the next sign. A unique risk tied to diabetes that can cause death in bed without warning. Part 6. Diabetes and dead in bed syndrome. The sixth sign you must pay attention to is a hidden but deadly phenomenon known as dead in bed syndrome, a sudden and unexplained death during sleep, often linked to diabetes. While most people associate diabetes with gradual complications such as vision loss, kidney disease, or circulation problems, the truth is that unstable blood sugar can kill silently in the middle of the night. Dead in bed syndrome is most often described in younger adults with type 1 diabetes. But seniors with long-standing diabetes are also at risk, especially if they are on insulin or medications that lower blood sugar. The mechanism is frighteningly simple. During the night, blood glucose may drop to dangerously low levels, a state called nocturnal hypoglycemia. Normally, the body responds with warning signs like sweating, shaking, or confusion. But during sleep, those signals may not wake you. As blood sugar continues to fall, the brain becomes starved of fuel. Seizures may occur. Heart rhythm may become unstable, and sudden death can follow before morning. Families often describe finding their loved one in bed without any struggle, leading to the name dead in bed syndrome. Research suggests that low blood sugar at night can trigger fatal arrhythmias by altering potassium levels in heart cells, essentially disrupting the electrical system that keeps the heart beating. Continuous glucose monitoring devices can sometimes sound alarms, but if the person sleeps through them or the device malfunctions, the warning is lost. What makes this especially dangerous is that even people who carefully control their diabetes during the day may still be vulnerable at night. High activity levels, skipped meals, alcohol consumption, or excessive doses of insulin can all set the stage for a deadly drop while sleeping. Symptoms that should never be ignored include frequent nightmares, waking drenched in sweat, or feeling unusually tired and confused in the morning. These may be signs of repeated nighttime hypoglycemia. Doctors recommend strategies such as adjusting medication doses, eating a bedtime snack with complex carbohydrates, and using continuous glucose monitors to reduce the risk. Seniors should also avoid alcohol in the evening, as it interferes with glucose regulation during the night. Loved ones can help by recognizing the warning signs and ensuring that diabetes management is consistent. The good news is that awareness and proactive steps can save lives. Dead in bed syndrome is rare, but when it strikes, it is often fatal. That is why no symptom should be dismissed as minor when it comes to diabetes and sleep. If you or someone you care for has diabetes, talk to a healthcare provider about nighttime monitoring and safe medication practices. If this warning has made you pause, wait until you hear about the next hidden danger, an environmental risk that can poison silently and cause death without a sound. Part 7. Carbon monoxide poisoning. The seventh sign you must never overlook is the risk of carbon monoxide poisoning, a silent killer that can take life during sleep without a single warning. Carbon monoxide is a colorless, odorless gas produced by incomplete combustion of fuel, faulty heaters, blocked chimneys, leaking stoves, or poorly ventilated generators can all release this invisible danger into your home. Unlike smoke or fire, there is no smell, no irritation, no immediate clue. As the gas enters the lungs, it binds to hemoglobin in the blood with an affinity more than 200 times stronger than oxygen. This means that even small amounts can quickly crowd out oxygen, leaving the brain, the heart, and every organ suffocating at a cellular level. During the day, you might feel dizzy, nauseous, or develop a headache and step outside. But during the night, when you are asleep, you may never notice the early signs. Victims often pass from drowsiness into unconsciousness, never waking again. Families sometimes describe multiple members dying in the same home because no one was aware of the gas filling the rooms. In fact, medical reports confirm that carbon monoxide poisoning is one of the leading environmental causes of nocturnal death worldwide. Seniors are particularly vulnerable because pre-existing heart or lung conditions make them less able to tolerate reduced oxygen. Warning symptoms, if they appear, may include morning headaches, confusion, weakness, or unexplained fatigue. Pets in the home may also appear sluggish or ill, serving as an early signal that something is wrong, but the danger is that often the first and only symptom is death in sleep. Prevention is the only true defense. Every household should have functioning carbon monoxide detectors placed near bedrooms and fuel-burning appliances. Regular maintenance of stoves, heaters, fireplaces, and chimneys is essential. Never run a generator indoors or in a closed garage. Seniors who live alone should be especially careful, as they may not notice small leaks that build over time. Doctors treating survivors emphasize that even non-fatal exposures can cause long-term problems such as memory loss, heart damage, or chronic headaches. For those with existing heart disease, carbon monoxide can trigger arrhythmias or even heart attacks by depriving cardiac tissue of oxygen. It is a cruel irony that the gas makes you feel sleepy, lowering your chance of escape just when your life depends on it. Remember that this is a threat that does not discriminate. It affects the young, the old, the healthy, and the sick. The difference between life and death is often simply whether a detector was installed and working. If this environmental risk shocked you, wait until you hear about the next danger. When medications and drug interactions taken before bed can quietly depress the brain's drive to breathe and lead to a fatal night. Part 8. Medications, overdoses, and drug interactions. The eighth sign you must pay attention to is the danger of medications, overdoses, and drug interactions that can silently claim a life during sleep. Many seniors take multiple prescriptions each day, often for blood pressure, diabetes, pain, or anxiety. While these medicines may be necessary, combining them incorrectly or taking too high a dose can depress the body's vital systems at night. The greatest risk comes from drugs that slow breathing or reduce alertness, such as sedatives, opiates, and certain anxiety medications. When these are taken before bed, especially with alcohol, the brain's respiratory center can be suppressed. Breathing becomes shallow, pause lengthen, oxygen drops, and the person may never wake again. Families often describe a loved one going to bed appearing calm, only to find them unresponsive in the morning. Medical data confirms that accidental overdoses are a significant cause of nocturnal death, particularly in older adults whose livers and kidneys clear medications more slowly, even when doses are correct. Interactions between multiple drugs can create dangerous effects. For example, mixing certain heart medications with antidepressants may cause irregular rhythms. Combining opioids with sleeping pills magnifies the risk of respiratory arrest. The signs can be subtle, unusual drowsiness, confusion, slurred speech, or difficulty waking in the morning. Sadly, these are often dismissed as normal aging rather than red flags. Doctors warn that seniors are more sensitive to medication effects because of age-related changes in metabolism. A dose that seems small for a younger person may overwhelm an older body. Even over-the-counter drugs like antihistamines or cough syrups can be dangerous when combined with prescriptions. Alcohol, often underestimated, further amplifies these risks. Preventing this danger requires careful management. Seniors should always keep an updated list of medications. Review it regularly with a healthcare provider, and avoid combining drugs without approval. Pill organizers, alarms, and caregiver oversight can prevent accidental double dosing. Never crush or split tablets unless instructed, as this can alter how the drug is absorbed. If a new medicine causes dizziness, confusion, or abnormal fatigue, seek medical advice immediately. Awareness is especially important at bedtime because sleep masks the early signs of overdose or interaction. Once unconscious, the body has little chance to recover without intervention. Medical journals highlight that reducing unnecessary prescriptions and simplifying regimens can lower the risk of drug-related deaths. Loved ones should be alert to changes in breathing or responsiveness at night in those taking sedatives or painkillers. Remember, medications can heal, but they can also harm if not respected. The same pill that eases pain or calms anxiety can, under the wrong circumstances, suppress life itself. If this warning has opened your eyes, wait until you hear about the next sign, when neurological conditions like epilepsy or trauma can trigger seizures, choking, or sudden collapse during the night. Part 9. Neurological and trauma-related risks. The ninth sign you must take seriously is the group of neurological and trauma-related risks that can quietly end life during the night. Epilepsy, head injury, seizures, and even choking are all conditions that strike without warning and are far more dangerous during sleep. People living with epilepsy face a risk of sudden unexpected death in epilepsy, often shortened to SUDEP. This phenomenon remains poorly understood, but medical research shows that seizures at night can disrupt both breathing and heart rhythm, leading to collapse before help can arrive. Families sometimes describe their loved one having a seizure in the night, then falling silent, only to be found unresponsive in the morning. The danger is amplified because the person is asleep, alone, and unable to call for help. Seniors who have suffered head trauma are also at risk. A fall, a concussion, or even what seemed like a minor injury can leave hidden bleeding or swelling in the brain. At night, these injuries may worsen unnoticed. Symptoms such as persistent headache, nausea, confusion, or dilated pupils after a fall must never be ignored. Doctors often recommend waking a patient regularly after head trauma to check for signs of deterioration. Ignoring this advice can lead to death in sleep from brain swelling or bleeding. Another silent risk is choking. While most think of choking as happening while eating, it can occur during sleep if someone vomits during a seizure, after heavy alcohol use, or when food or lozenges are left in the mouth before bed. Seniors with swallowing difficulties, often due to stroke or neurological disease, are especially vulnerable. Aspiration of food or liquid into the lungs can block the airway, leading to suffocation without a sound. Snoring, coughing, or gasping in the night may be dismissed as harmless, but can signal dangerous airway obstruction. Trauma itself is also a hidden factor. Statistics show that traumatic brain injury contributes to nearly 1/3 of all injury-related deaths in some countries. A person may go to bed after an accident believing they are fine, yet internal bleeding in the brain can progress silently until it becomes fatal overnight. This is why medical professionals emphasize monitoring and follow-up after any head injury. No matter how minor it seems, the key message is that the nervous system is fragile, and nighttime makes it harder to recognize early warning signs. A seizure, a bleed, or airway blockage can move from dangerous to deadly in minutes when no one is watching. Preventive measures include strict adherence to seizure medications, avoiding alcohol or triggers before sleep, seeking immediate evaluation after head injury, and never sleeping with food or objects in the mouth. Loved ones should be vigilant for unusual sounds, movements, or breathing patterns at night, especially in those with known neurological conditions. Remember, silence is not always safety. Sometimes the quiet of the night hides a crisis in progress. If this warning concerns you, wait until you hear about the final danger. When hidden sleep disorders like sleep apnea or parasomnias can quietly raise the risk of sudden death while you rest. Part 10. Sleep disorders and parasomnias. The 10th sign you must not ignore is the hidden danger of sleep disorders and parasomnias. Conditions that may seem harmless but can quietly turn fatal during the night. One of the most common is obstructive sleep apnea, a disorder in which the airway repeatedly collapses during sleep, causing loud snoring, pauses in breathing, and sudden gasps for air. Each pause deprives the body of oxygen, straining the heart and brain. Over time, untreated sleep apnea raises the risk of high blood pressure, heart attack, stroke, and sudden cardiac death. Seniors with obesity, diabetes, or a history of snoring are especially vulnerable, and many do not realize that waking with a dry mouth, morning headaches, or daytime fatigue are warning signs of a life-threatening condition. Another group of risks comes from parasomnias, which are abnormal behaviors that occur during sleep. These include sleepwalking, night terrors, and REM behavior disorder, where a person physically acts out dreams by kicking, punching, or even running. While these events are often dismissed as strange or amusing, they can lead to falls, injuries, or in rare cases, fatal accidents. Imagine a person unknowingly leaving the safety of their bed, walking into traffic, or striking furniture in the dark. Some cases have even been reported where individuals walked off balconies or out of homes while still asleep. Alcohol, stress, and certain medications can make parasomnias worse, increasing the risk of dangerous episodes. The most severe form, status dissociatus, involves intense motor activity like screaming, running, or thrashing, often linked to psychiatric conditions or withdrawal from alcohol. Without intervention, This can lead to self-harm or death. Medical studies have confirmed that sleep disorders contribute significantly to nighttime mortality, not only by direct accidents, but also by worsening other conditions such as cardiovascular disease. The tragedy is that many seniors assume loud snoring or restless sleep is normal, when, in fact, these are red flags that should prompt immediate medical evaluation. Treatments are available. For sleep apnea, continuous positive airway pressure devices can keep airways open and restore safe breathing throughout the night. Wear PARASOMNIAS, creating a safe sleep environment by removing sharp objects, locking windows, and avoiding alcohol or sedatives can prevent harm. Cognitive behavioral therapy and medications may also help control symptoms. Loved ones play a vital role in noticing abnormal sounds, movements, or breathing changes at night. Their observations can provide doctors with the clues needed to make a diagnosis and prevent tragedy. The most important message is that sleep is not always safe. Disorders that disrupt breathing or cause dangerous behaviors may turn the hours of rest into hours of risk. Recognizing and treating these conditions can mean the difference between waking to a new day or never waking at all. Now that you have heard all 10 signs, let us move to the conclusion, where I will remind you of the key lessons and show you why it is never too late to protect your life during the quietest hours. Conclusion. We have now walked together through 10 silent but deadly signs that can turn the quiet hours of sleep into the most dangerous time of day. From sudden cardiac arrest and heart attacks to respiratory failure, diabetes, poisoning, medications, neurological crises, and hidden sleep disorders. The message is clear. What feels like a peaceful night can hide threats that strike without warning. The tragedy is that many families only discover the truth in the morning, when it is too late to act. But you are different because now you know the warning signs. You know that chest pain, unexplained sweating, gasping for air, restless sleep, or unusual behaviors are not to be dismissed as aging or stress. They are alarms from your body. Alarms that beg you to listen. As a doctor, I must tell you that prevention is your greatest weapon. Regular checkups, careful medication management, treatment for sleep disorders, and creating a safe environment at night can all save lives. Even small choices matter, like avoiding alcohol before bed, using detectors for carbon monoxide, eating wisely, and respecting the signals of your body. Do not underestimate the power of awareness. Every senior deserves the chance to wake each morning, to see loved ones, to live with independence and dignity. Your body still remembers how to heal. Even after years of strain, your heart longs to beat steadily. Your brain longs to stay sharp, and your lungs long to breathe freely. Each step you take toward safety gives your body the chance to do what it was designed to do, to keep you alive. Share this knowledge. Protect your spouse, your children, your friends. Far too many lives are lost because people never knew the risks or brushed off the signs. You can change that. By sharing this video, you may save a life tonight. Now, I would love to hear from you. Take a moment to reflect and share one thing you have learned and plan to apply in your own life. Let us support each other in building safer nights and healthier mornings. If you enjoyed this video, comment 1. If not, comment 0 so I know how to improve. Do not forget to like, share, and subscribe so you never miss another health tip made especially for seniors. Remember, it is never too late to change. It is never too late to protect your heart, your brain, your memory, in your life. Sleep should be a time of healing, not of danger. With knowledge and action, you can make sure that each night leads safely to a new dawn.